Hello and welcome. Today we're diving into a relatively rare, but serious complication of syphilis, syphilitic lesions of the upper respiratory tract. This condition highlights the far-reaching effects of untreated syphilis and the importance of early detection and treatment. We'll explore its causes, how it affects the body, what signs to look for, and how it's managed. Syphilitic lesions of the upper respiratory tract are caused by the bacterium Treponema pallidum, the causative agent of syphilis. This occurs most commonly in the tertiary stage of syphilis, which can develop years, or even decades, after the initial infection if left untreated. The bacteria can spread to the nose, pharynx, larynx, and trachea, leading to the formation of destructive lesions. The pathophysiology of syphilitic lesions involves the invasion of Treponema pallidum into the tissues of the upper respiratory tract. This invasion triggers an inflammatory response, leading to the formation of granulomas called gummas. These gummas can ulcerate and cause significant tissue destruction. Over time, this can lead to scarring, strictures, and deformities of the affected areas. The specific mechanisms involve immune responses, endarteritis obliterans, inflammation of small arteries, and tissue necrosis. Epidemiologically, syphilitic lesions of the upper respiratory tract are rare in developed countries due to widespread screening and treatment of syphilis. However, it is more prevalent in areas with limited access to healthcare and inadequate syphilis control programs. Individuals with HIV infection are also at increased risk of developing tertiary syphilis, including involvement of the upper respiratory tract, due to impaired immune function. The signs and symptoms of syphilitic lesions in the upper respiratory tract can be varied and depend on the location and extent of the lesions. Common symptoms include persistent sore throat, hoarseness, difficulty swallowing, nasal obstruction, nosebleeds, and facial pain. In severe cases, there can be destruction of the nasal septum leading to a saddle nose deformity, or involvement of the larynx leading to airway obstruction and stridor. A persistent non-healing ulcer in the mouth or throat should also raise suspicion. Diagnosis typically involves a combination of clinical evaluation, serological testing, and imaging studies. A thorough medical history, including sexual history, is crucial. Serological tests such as VDRL and RPR are used to screen for syphilis, and specific treponema tests like FDABS or TPPA are used to confirm the diagnosis. Imaging studies, such as CT scans or MRI, can help to assess the extent of the lesions and any associated structural damage. A biopsy of the lesion is often performed to confirm the presence of Treponema pallidum and rule out other conditions such as cancer or fungal infections. While specific classifications aren't typically used, syphilitic lesions of the upper respiratory tract can be categorized based on the anatomical location. This includes nasal syphilis affecting the nose and sinuses, pharyngeal syphilis affecting the throat, and laryngeal syphilis affecting the voice box. Each location presents with slightly different clinical manifestations and management considerations. The treatment of syphilitic lesions of the upper respiratory tract primarily involves the administration of penicillin. The specific dosage and duration of treatment depend on the stage of syphilis and the severity of the lesions. In some cases, surgery may be necessary to repair structural damage, such as nasal septum perforations or laryngeal strictures. Supportive care, such as humidification and pain management, may also be needed. Close follow-up is essential to monitor treatment response and address any complications. The best way to prevent syphilitic lesions of the upper respiratory tract is to prevent syphilis infection in the first place. This includes practicing safe sex, such as using condoms consistently and correctly, and getting tested regularly for sexually transmitted infections, especially if you have multiple partners. Early detection and treatment of syphilis are crucial to prevent progression to the tertiary stage and the development of complications like upper respiratory tract lesions. Partner notification and treatment are also essential to prevent further spread of the infection. The prognosis for syphilitic lesions of the upper respiratory tract depends on the extent of the lesions, the timeliness of diagnosis, and the response to treatment. Early diagnosis and treatment with penicillin can often lead to resolution of the lesions and prevention of further damage. However, if left untreated, or if there is significant structural damage, the prognosis can be poorer. Recent research focuses on improving diagnostic methods for early syphilis and developing more effective treatment strategies, particularly for penicillin-resistant strains, although these are rare. Furthermore, research is underway to better understand the immunological mechanisms involved in tertiary syphilis and to identify potential targets for immune-based therapies. Thank you for joining us in learning about this important topic.